Key question on Capitol Hill. Will Obamacare tax credits survive? As Congress braces for a critical debate, the question of whether to maintain tax breaks introduced during the COVID pandemic is at the forefront. These breaks have significantly reduced the costs of health insurance premiums under the Affordable Care Act, ACA. And their continuation could mean the difference between affordable health care and soaring expenses for many Long Islanders and Americans nationwide. In the coming days, a constellation of Democrats, particularly those in the lower ranks, who feel that their party's leaders have not been forceful enough in their past confrontations with Republicans and former President Trump, are gearing up for a major showdown. Their objective? However, this quest faces stiff opposition from influential Republicans and conservatives who currently wield power in both the House of Representatives and the Senate. They adamantly believe that these enhanced tax breaks, initially intended to be temporary, should come to an end as planned on December 31st. These leaders have flatly rejected any proposals to prolong these financial aids in any stopgap or extended funding measures. Risking a government shutdown on October 1st. Top Republicans like House Budget Committee Chair Jody Arrington, R. Texas, argue this position clearly. This was part of the temporary policies that were meant to serve as a safety net during the pandemic, he stated. They were never intended to last indefinitely. Conversely, New York's junior senator, Kirsten Gillibrand, who also chairs the Democratic Senatorial Campaign Committee, fervently disagrees. She is actively rallying her congressional colleagues to ensure the inclusion of an extension for the ACA's enhanced premium tax credits in any forthcoming government funding legislation. These subsidies save lives, and I'm committed to keeping them intact, Gillibrand contends. It's noteworthy to mention that Gillibrand has not suggested that the Democrats should instigate a government shutdown if their demands aren't met. In contrast, Senate Minority Leader Chuck Schumer, another prominent Democrat from New York, has publicly acknowledged that he's prepared to risk a governmental impasse if necessary, indicating a willingness to stand firm on this issue. Both Schumer and House Minority Leader Hakeem Jeffries D. Brooklyn have signaled that they will demand substantial healthcare-related compromises from Republicans as they highlight what they call an emerging healthcare crisis, largely attributed to the policies initiated during the Trump administration and sustained by GOP governance. The Republicans need to engage with us in a genuine bipartisan dialogue to address the urgent healthcare needs of the American populace, or they can expect us not to support their initiatives, plain and simple, Schumer cautioned during a recent press conference. Impending deadline. As the clock ticks toward the end of September, the must-pass federal spending bill will serve as the first litmus test for these tensions. Even if Congress opts for a temporary, emergency funding solution, it will necessitate some level of support from Democrats to ensure its progress in the Senate. The stakes remain incredibly high for millions enrolled in the ACA, also known as Obamacare. Traditionally, this program includes financial assistance based on income levels. However, these subsidies were significantly improved through legislation passed in 2021 during the pandemic, and again in 2022 when previous income limits were lifted, allowing even more individuals at varying income levels to qualify. If these enhancements are permitted to sunset on December 31st, a staggering 4.2 million Americans could face precarious health coverage situations, according to congressional fiscal analysts. In New York alone, over 1.6 million residents subscribe to the Essential Plan, and approximately 140,000 individuals enrolled in qualified health plans currently benefit from these enhanced premium credits, as detailed by the state health department. The potential impact would be severe, with statewide average premium costs projected to jump by about 38% if these tax credits vanish. This would translate into average monthly premium hikes of approximately $114 for individuals and $228 for couples, rendering these health plans unaffordable for thousands of New Yorkers, as highlighted by the state's analysis. On Long Island specifically, 117,200 enrollees in Nassau County and 133,500 in Suffolk County currently rely on these subsidies. If the credits were to disappear, those individuals could see their monthly premium costs increase by an average of 32%, with individuals facing hikes up to $115 per month, and couples seeing increases up to $219. Strategic outlook. Just earlier this month, Schumer reached out to major health insurance providers, urging them to alert current enrollees about the looming expiration of the enhanced ACA subsidies. This approach is intended to galvanize public support to push Republicans towards extending these vital tax breaks. However, Schumer has yet to publicly disclose his specific strategy in the current climate of robust GOP opposition, particularly in relation to securing even a mere one-year extension of the credits. It remains uncertain whether his recent warning about potentially withholding votes in healthcare negotiations would extend exclusively to this issue. On the Republican side, Senate Majority Leader John Thune, our Senator SD, dismissed suggestions that any language for extending tax credits would be included in a short-term funding measure aimed at averting an imminent federal shutdown. According to him, he prefers a clean bill. Although he didn't rule out discussions for a larger appropriations package later in the fall, immediate inclusion appears unlikely. House Speaker Mike Johnson, R.La., has voiced skepticism regarding the idea that Democrats might instigate a shutdown over these matters, citing perceived struggles within their party. He stated, "That's not surprising. They're grappling with their messaging and facing declining approval ratings." Republican perspectives. Despite the prevailing hardline stance, some Republicans appear to be softening their approach. For instance, Andrew Garbarino, R. Bayport, a member of the House Committee on Homeland Security, confirmed participation in discussions regarding options for the premium tax credits during a recent leadership meeting. He emphasized, "These conversations are ongoing, and we are focused on finding a solution to prevent people from losing their insurance." Additionally, Long Island's other representative, Nick LaLota, R. Amityville, has expressed interest in following these discussions closely. 11 moderate House Republicans, many facing competitive re-election battles in the coming year, have already co-sponsored bipartisan legislation that proposes extending these tax benefits for another year. On the political front, some Republican strategists warned that internal polling suggests voters might respond negatively to GOP efforts if these subsidies are allowed to expire, especially given the party's previous challenges related to health care. Tom Suozzi, a Long Island representative who serves on the Tax Writing Ways and Means Committee, recognized that addressing this issue falls squarely on the shoulders of the party in power. He firmly stated, "We cannot allow those who depend on these subsidies to confront thousands of dollars in increased health insurance premiums due to the expiration of these tax credits." By Billy House.